recording.
Emily's. This is my audience. Okay, the title of my speech is The Benefits of Medical Marijuana. Over 2 million people in the U.S. today are legally smoking marijuana. But of those 2 million people, they aren't smoking it recreational use, but they are smoking it to help benefit their disorders and drugs, and they are prescribed for it by their physicians. I personally know of a family friend that was diagnosed with cancer, and she was prescribed by her physician marijuana to help with her nausea. And she was able to interact with her family and friends without having to worry about her disease. And so according to procons.org, in America today, there are 20 U.S. states and 60 U.S. health organizations that have now legalized marijuana for medical use. Although marijuana is proven to help several different diseases and disorders, I today am going to inform you of how it benefits the patients that are diagnosed with cancer and multiple sclerosis, also known as MS. One of the main reasons marijuana is used for medical use is because it decreases the side effects of patients that are diagnosed with cancer. Cancer is a disease that takes over a person's entire body and attacks their cells. And it comes in different shapes and forms, and it takes over a person's personality, and they are not able to function day to day. And according to the Daily Beast article in 2012, Martin A. Lee states, mounting evidence shows cannabinoids in marijuana slows cancer growth, inhibits formation of blood cells that feed on tumors, and then third, helps maintain pain, fatigue, nausea, and other side effects. This is just a few of the things that marijuana has been able to improve with patients that are diagnosed with cancer. Also, what I've come across while researching is a young biologist at Complutense University in Madrid named Cristina Sanchez was in the middle of studying cell metabolism and suddenly found that a patient that was exposed to tetrahydrocannabinol, also known as THC, whenever they were exposed to this, the cancer cells were dying. And THC is in marijuana, and it's a main ingredient in it, so whenever the patient is exposed to this, it obviously is now it's known for killing some of the brain cells, cancer cells. We all know that along with cancer, chemotherapy is also sometimes needed to treat cancer patients. Well, again, according to the Daily Beast, they also reported that marijuana offers a non-toxic therapy that treats for severe cases and forms of cancer without the dreadful side effects of chemotherapy. Could you imagine knowing someone that could completely avoid those side effects that chemotherapy shows? Seeing all these wonderful results from medical marijuana, how could a person not agree that it is helping those with cancer? Well, along with cancer, the second main idea that marijuana has been proven to help is multiple sclerosis. Multiple sclerosis is a nervous system disease that affects a person's brain and spinal cord. And as of today, there's no known treatment. The Center of Medical Cannabis Research, which cannabis is another term, it's the medical term for marijuana. The Center of Medical Cannabis Research was started through University of California in San Diego in 2000. They did an experiment on 6 randomized clinical trials to test how it affected those with MS after they had smoked marijuana. The scientists that performed this experiment stated, "We now have reasonable evidence that cannabis is a promising treatment in selected pain syndromes caused by injuries or diseases of the nervous system, and possibly for painful muscle spasticity due to MS." In 2008, according to a normal website, statistics shows that 1 in 2 of every MS patient is now using marijuana. So obviously it is becoming more and more popular because it is effective. Also, same for cancer cells, the THC in marijuana also boosts the immune system in patients that have MS. Marijuana is the reason that MS-related symptoms such as pain, spasticity, fatigue, and depression, have all become not as big of an issue. So today, we have discussed the effects of both cancer and multiple sclerosis. Knowing that it helps with side effects such as fatigue, depression, and spasticity, it is evident that it is improving one's everyday life. So, the reason I think medical marijuana is so important to the people in the U.S. today is to help make life more enjoyable for those who are diagnosed with cancer and multiple sclerosis. Thank you. Here's my audience again.